My motivation to make cities and mobility more inclusive is to improve accessibility and opportunities for everyone, to create healthy environments that promote the physical, the mental, and social health of the communities in general, and also to promote active and independent travel for children, because this has many health benefits. And the thing here is that many of our children, I work mainly with children in Cali, Colombia, and they walk to school. About almost 80% of them walk to school, but there are also so many risks that they face. So our challenge is how we keep these children walking, after they're able to maybe have the possibility to buy a motorcycle. How can we keep them walking and cycling? And for this, we need to address all the risks that they face every day, that go from road safety to personal safety to even sexual harassment and anything from the environment that limits their mobility. Yes, for gender-sensitive planning, I think travel patterns are key. We did a study recently in Bogota, and we found that the travel patterns for women and men are completely different. For example, in low-income areas, we found that women spend 16% more time commuting, and they also use more public transit. Also, women walk more within the neighborhoods. So this is really important because, for example, we noticed that many of the road safety measures that we're putting into place to improve road safety in the city in general are for arterial roads. But we found that if you want to improve the road safety for women, you would have to start by implementing road safety measures within the neighborhoods, because we walk more and we use public transport more, so we are pedestrians basically. And the deaths of men were, or the fatalities of men were mainly in the arterial roads, while the fatalities for women were within the neighborhoods. So in the planning sense, in this example, we would have to implement low speed zones to improve the women's road safety, and also other measures for arterial roads, but we would have to focus in different measures for women. I also think we have to look into safety in general, personal security, and also sexual harassment. We work with many children and adolescents, and we ask them about their mobility, how they move around in the neighborhood, what are the risks that they perceive. And it's interesting that they say that for them, crossing the street is dangerous. About 9 of 10 girls say that crossing the street is dangerous. But also the sexual harassment is something that limits our access to the city and our mobility. And it's interesting to see that when we did the study, about 30% of the children, of the girls that were 9 to 12, they said they experienced sexual harassment in their daily journeys, 30% 9 to 12. But this number goes up to 71% as they turn, as they go from 13 to 16 years old. So sexual harassment is really an issue that limits our mobility, and we should focus on that in our planning. If we want to promote walking and cycling, we need to address this type of issues that really limit the mobility of women. I think I agree with the statement because of what I've mentioned before. When we did a study on travel patterns in Bogota, we found that women move differently than men. Women use more public transit in general, and low-income women also spend 16% more time than men in commuting. Also, as I told you before, we move a lot on foot within our neighborhoods. So, for example, if we want to improve the mobility for women that walk or bike, you would have to build infrastructure within the neighborhoods, not only in the arterial roads. Another thing that we found that was, also about planning is that For example, we were checking the whole map of Bogota, and we were looking at the trips that were made by bicycle by women. And we found that the places that had no infrastructure had 0 trips on bicycle for women. So it's very important to build infrastructure so they can feel safe and they can move around safely. If we want to improve the mobility, the number of women on bicycles. We also found actually that the number of people on bicycles, or the percentage of people that move on bicycle, has been increasing. But when you look at this number, you see that for women, this has been decreasing. So overall, we have an increase of women, of people moving around on bicycle. But for women, it went from 25% in 2011 to actually 21% in 2015. So this shows that our policies need to be also, they need to have a gender perspective, because yes, it's working. We have more people moving around on active transport on bicycles, but many of this share has decreased actually for women. So how can our policies, our planning, our infrastructure be focused to also increase the number of women moving around on bicycles or on foot?